Hey, Dr. George here. Just finished up a sleeve gastrectomy on a patient that's soon to be very, very happy. I wanted to take a minute to talk to you all about one of the commonly asked questions that I get, which is, how do I pick what is the right intervention for weight loss? And I've talked about this in other videos beforehand, but the question is always happening, and it's a great question to ask because ultimately people want to know, well, I see information on social media or online about weight loss medications or about gastric balloons or about bariatric surgery or my friend had a lap band or a sleeve or a bypass or something like that, and you're not entirely sure what to pick. So one of the very first things you need to do is you need to ask yourself, what is your goal? Okay, how much weight are you trying to lose? The fact of the matter is that all of these things that I just mentioned, whether it's medications or gastric balloons or the different kinds of bariatric surgery, they're like buying a car. They're going to give you a certain amount of performance. And if you are, for example, trying to get something with great gas mileage, you probably don't want a Ferrari, right? And if you're trying to race around a track and have a high performance type of vehicle, well, you probably don't want a Toyota Prius, right? So the idea is to start with your goal in mind. How much weight are you trying to lose? If you are trying to, and you need to sit down and maybe just crunch the numbers. Look at your weight now and look at your goal, right? What are you trying to get down to? What would be sort of a reasonable, happy weight for you to get down to? And then, most people have a couple of numbers. They have a number that would be their perfect weight. And then there's a number that they're like, you know what, realistically, I'd be happy with this weight, okay? And ask yourself, well, how much weight loss do you need to get to those two numbers? And then split the difference, all right? So, these days, weight loss specialists pretty much sort of do a calculation called total body weight loss, okay, as a percentage. So, let's say you're 200 pounds, right? And your goal is to lose 100 pounds, then that's, 50% total body weight loss that you're trying to achieve, okay? Just as an example. So, I'm a very data and objective individual when it comes to making suggestions, right? So I look at what the data, the evidence is out there. What does the FDA trials show? What do the studies show, so that when I make a recommendation, either through YouTube or to my patients that are coming for consultation in the office and ask me what they should be doing, it's based off of the best available evidence out there, okay? And we all know, for example, that with weight loss medications, there is a lot of hype out there for good reason. And there's some exciting news about medications out there that can really help you lose more weight than some of the older medications, right? So if you hear about Wegovy or Ozempic or Mounjaro or any of those medications, there's a lot of advertising and a lot of hype. And those medications are great. But they're not going to help you lose as much weight as, for example, a bariatric surgery, okay? If you look at the averages for weight loss medications, the newer ones, you're going to drop down about 15% of your total body weight. And that's an average. Some people lose more, some people lose less. So as I've mentioned in other videos, that's in conjunction with comprehensive diet and exercise program, all right? And if you're willing to stay on medications like that long term, you can have around an average of 15% total body weight loss. Some people lose more. I've had people lose over 20% total body weight loss on, semaglutide type of weekly injection. All right. As I mentioned in other videos, once you stop those medications, all right, there's evidence, there are trials, right, that show that people will regain most of their weight back when you stop the medications. So you have to stay on those medications relatively long term. Okay. When it comes to bariatric surgery, there's the major types of bariatric surgeries that we offer, at least first time around, are lap band, sleeve gastrectomy, and a bypass. And lap band on average is going to help you lose maybe 20 to 25% of your total body weight. And there's that term, total body weight loss, that we're talking about. Sleeve is on average about 25 to 30%, and a bypass is 30 to 35%. A duodenal switch, which is sort of like a bypass with a longer portion of the intestine that's bypassed, can be 35 to 40%. There are surgeons out there that do a duodenal switch as a first-time operation. I personally don't. I usually save that kind of the back in the arsenal for people that have had a sleeve or had something else done and they need a second type of revisional surgery to get themselves over the finish line for the weight loss goal. So those numbers are important to know as you're making a decision, because if you're trying to lose, let's say 30 or percent of your total body weight, right, then, medication may not be a great long-term option for you. Now, we use medications for people that don't want to have surgery, right? They're scared of surgery. They're like, you know what, it's not for me. That's fine. Then lose some weight, do medication, right? Because losing some weight, even if it's only 5% or 10% of your total body weight, is going to make a huge difference with your quality of life, how you feel, your health conditions or medications you're on. So losing some weight's better than none, okay? But just be realistic about what you can sort of obtain from all these different methods to lose weight. And, it starts with, what are your goals? How much weight are you trying to lose? And, and then, as I mentioned in other videos, ask yourself, what kind of person am I? What is my personality? Am I willing to undergo a procedure to get this done? Knowing that it's more effective, but knowing that, whether it's medications or surgery, there's either side effects or complications that you have to think about. So, the chance of having a major complication after a bariatric surgery is less than 1%. It's not zero, okay? So bleeding, infection, injury, something you don't mean to injure, all those types of things, hernias, they can happen, okay? It's extremely low, right? And if it's done in the right hands by someone that does a lot of these at a hospital, or someone that does a lot of these, your complication risk is quite low. Add that up next to your chance of having a complication with, not losing weight. Diabetes progressing, heart disease, cancer, quality of life, right? All of those types of things. A lot of people don't think about those risks next to surgical risks. So, and also realize that risks, we take risks every day. All right, whether you take the bus or you get behind the wheel and drive, right? You're taking a risk getting on the road. You can be the safest driver in the world and still, unfortunately, have an accident, right? So these are all things that I want you to take a step back and think about as you're trying to make a decision about what to do if you have some weight problems, and understand that something's better than nothing, right? If medications are really the only thing that you're thinking about, then try them. Okay, just realize that what you can achieve with them, realize that you might have some side effects with them, realize that you might need to stay on them long term. Surgery is also not a magic pill or a magic cure, right? So yes, the results can be more than medications, but ultimately you still have to work for it. You still have to make behavioral changes and sustainable long-term habit changes that are going to carry you long-term with your weight loss, as I mentioned in other videos. And if you do that, any of these tools will help you long-term. If you want to know more, listen, go to our website, newhopesurgical.com or .net if you speak Spanish. We are happy to discuss this on our YouTube channel. You can send me a message. Thumbs up, subscribe to my channel so you can get more content, post comments, post questions on my YouTube channel. So I'm happy to get back to you and answer them for you. All right, everyone have a great day.